ladies, in this lesson we're going to talk about symptoms that may arise with having a C-section. So with a C-section, we know that lots of scar tissue can adhere down all over the place. And with having our bladder so close to our uterus, when it sits in front of the uterus, that can cause some bladder discomfort or lower abdominal pain. So the scar on the uterus can attach to that bladder and say when the bladder's filling up with urine, if it feels like it can't stretch any further, it's going to feel this response of, oh, I gotta go because I can't stretch anymore because I feel like I gotta pee, and then you're gonna want to urinate. So it may increase urgency and frequency for you. This may happen often because if that scar is hindering its mobility to be able to stretch the full capacity to hold the amount of fluid that it needs to, you're gonna be running to the bathroom a lot sooner. This can also create some abdominal discomfort and pain. You may feel lower abdominal cramping and bloating. This could be from the bladder, it could be from lack of mobility in the bowels as well. You can also have increased sensitivity around the clitoral and labial tissue. That uterus, the ligaments come out and support or attach at that pubic bone. So if the scar tissue is pulling on that ligament that attaches to the pubic bone, it could tighten up around the nervous system there. So touch or feeling if your partner's trying to get fresh with you and get a little frisky and it's just really uncomfortable and heightened, like maybe the muscles tighten up, that could be the hypersensitivity of the nervous system that we need to calm it down because it shouldn't really behave that way after having a baby. You can also create low back pain. If the scar tissue is decreasing mobility in the uterus, there are also ligaments that attach to the low back. So if that scar tissue is hindering mobility on one way, let's say the left side, you may feel left SI or low back discomfort from that. It can also cause constipation. It can cause pain with intercourse. The muscles can lose mobility or be guarding. So if we try to insert something into the vaginal tissue, that could really be hypersensitive due to the lack of mobility and can cause that pain with sex. We would want to improve that. So those are some symptoms that can happen with having a C-section, and our goal is to keep those from not happening or to improve them. These are all very common and things that we can improve.